विश्व में हमने युवाओं की आईटी एनर्जी के माध्यम से अपना एक रुतबा खड़ा किया है और भारत इसके बात के लिए गर्व कर सकता है। दुनिया में हम आंख में आंख मिला करके बात कर सकते हैं। और ये मेरा साफ मैं हमेशा कहता आया हूं, आईटी प्लस आईटी इज इक्वल टू आईटी। इंफॉर्मेशन टेक्नोलॉजी प्लस इंडियन टैलेंट इज इक्वल टू इंडिया टुमारो।
Good morning to one and all on the day 2 of Diagnostics Leadership Summit. Thanks to each one of you who had shared the questions and made the sessions interactive. We had 350 plus delegates in the day 1 and we are expecting the same in the day 2. And we are heading on to the first topic, which is very important, adapting laboratory operations to managing the pandemic. I would like to introduce the panel. We have Dr. Sanjay Arora, founder and managing director, Suburban Diagnostics. Dr. Arora will be moderating the session, and along with him, we have Mr. Pankaj Nath, associate director, service about Diagnostics India. Welcome, sir. Dr. Sujay Prasad, medical director, Newburgh Diagnostics. Welcome, Dr. Sujay. Dr. Srinivas Chakravarti, N. Laboratory Director, Head Transplantation, Immunology and Molecular Diagnostics, MIOT International Hospital, Chennai. Welcome, Dr. Srinivas. Ms. Dr. Renu Saxena, Director of Pathology and Lab Medicine, Head of Hematopathology, Medanta, the Medicity Hospital, Gurgaon. Welcome, ma'am. Over to Dr. Arora for the session.
Pratibha, thank you. Good morning to all the delegates and to my fellow panelists. Thank you so much for joining us this morning. The topic that we have in front of us has been a very challenging one for all of us over the last 10 plus months, almost 11 months now. So let's get straight into it. And we've had challenges around people, challenges around kits, challenging around ramping up volumes, and of course the equipment that supports us. So I guess the first challenge is always around people, and I'll direct my first question to Dr. Renu. Ma'am, you lead a very large hospital setting, and just could you share your experience? How did you manage to rally the staff, especially during when there was complete lockdown and there were travel restrictions? And how do you continue to manage that today? It's been 11 months since it started. So could you share your experience, please?
Yeah, sure. At the outset, I'd like to thank for inviting me for this very interesting panel discussion. And we did have a lot of challenges in getting the staff here. And to name a few things, first of all, the most important thing that we faced was to motivate these people to work for this COVID time. And that was very important, took a lot of counseling to get them motivated. Then about the travel. Travel was a big issue because a lot of our staff comes from outside Gurgaon, and many of them actually come from Noida, which means they have to cross 2 borders before they reach us. And since there were restrictions everywhere, so one good thing that happened was whenever they showed their ID as a Medanta or a medical professional, it was easy to kind of get through, and not many were really stopped. But what did affect our work was the transport. And transport was a big, big issue. So what we did was we asked them to pull up. So people coming from one area or people who were on the way, we asked them to pull up in with those who had vehicles, cars of their own. We even at some point of time tried to see if we could have a bus at least go locally around Gurgaon, picking up people with social distancing in the bus, but that didn't really work out. So the best thing that we actually relied on was friends grouping up and coming, maintaining the social distance and the mask even within the car, not going beyond three or like that. Another big challenge that we faced was the blocks at the various city borders, and especially with those people who did not have people coming around with personal conveyances. So what we did was we hired an accommodation right near the hospital premises, and we permitted these people to take shared rooms there and they could stay there. So then it was easy. They could kind of just walk into the hospital and go back. And we also batched them in such a way that if they were working for, let's say, 7 days in the COVID, we gave them 2 weeks quarantine after that. This was as per the rules, because since they were handling very high sensitive material, we let them do that. And this naturally then led to the shortage. So the other thing that we experimented was we tried to train people while they were working so that we could have two groups working simultaneously and two groups who would be off simultaneously. So, I mean, these are ways with which we experimented and managed to tide over the situation that was there. One more thing that we noticed was that the moment they became proficient with a particular test, because for them these things were new, all the RT-PCR for this was not something they were doing earlier, so we started new. The moment they became proficient, I mean, they got job offers from various places, and always there was a threat that they will leave. So, we kind of tried to see if we could incentivize a little bit and keep them motivated. That was a very important part of personnel management that I felt.
Right. I think
so. Does that answer a lot of your questions?
Absolutely. I think making the staff comfortable, looking after the team probably was one of the important lessons that we all got, that if we look after the team and keep them motivated, I guess, because they were doing a job that was probably unprecedented at this point of time. So I think that's a great example of what you shared, Dr. Renu. Thank you so much. Dr. Sujay, one of the challenges most labs faced, and you must have faced this probably because you have a very large network, was predicting the testing volumes. I guess when we all started, there were maybe a few hundred tests a day, and it must have gone to a few thousands over the last few months. How did you handle that in a running operation? It must have been so challenging that, how do you predict the volumes? How do you increase the staff? How do you get kits? How do you manage? So just maybe you could share your experience on ramping up testing and predicting that in a running lab setup.
Thank you, Dr. Sanjay. I think looking back, I think all of us have done reasonably well, and I think that's very important to know. But during the time when it actually hit us, the uncertainty was so high. It was up to the management to really start getting our act together. So we started what we call the COVID task force, and the COVID task force had senior members from all the departments, and whether it's HR, logistics, or any of those. And as we started and staff movement within the lab during the pandemic, we quickly realized that the numbers we were doing about 100 per day. In a couple of weeks, it went up to 5,000 per day, that was the range of our testing ramp up. Clearly, there were a few things that I think helped us, and one is the identification of the kit. We identified kit based on a criteria that we set up front. We wanted one E gene and two discriminatory genes, and then we needed one internal control, human RNAs. So that was set, and then we chose one vendor and one backup vendor. So with this, we started to keep letting them know that our numbers are increasing. While we ordered for a week, it got over in 2 days. So it gave us 48 hours to really tell the vendor to ramp up and give us additional kits. But
Right.
more importantly, I think reagent is one part of it. The other part is actually handling the kind of numbers that are coming in. And I think information management became the key.
Sure.
How do you accession thousands of samples without stressing out the staff and without
Absolutely.
increasing the errors? So we brought in data science to help us there to track every sample right from the accessioning till the report release,
Right.
including the turnaround time. I think that was very important for us. So I believe a couple of things helped us. The creation of a task force that was overseeing all activities within the lab.
Right.
Second thing is the information management that really, meaning we probably could have handled it, but the number of errors would have been much higher.
Right. Right. Now we all know, Sujay, that and I call it an annual pilgrimage when I visit Sujay's lab. Every time you go there, you learn something new about how he uses technology to make a big difference. And I'm sure, Sujay, that must have played a big role, as always, in the way you manage your workforce. So thank you for that. It reminds me of one incident where a large consignment of kits unfortunately was being routed via China. And at that time, I think there was this, trade limitation between India and China. So even though there were critical kits that needed to be given to the labs for testing, but because the government had that standoff, we were not able to get those kits because they were being routed via China. Yeah, I guess we learned a lot of those political, implications as well. But thank you, Sujay, for that. Dr. Srinivas, I remember when somebody in our team, when the first person tested positive, it created so much of apprehension and anxiety. Would love to get your experience that, I'm sure people working in the hospital setting or the lab setting, when the first person tested positive, how did you handle that with your team and how did you sort of control that going forward?
Thank you, Ararav. I think that's a very good question, I think. So initially, what happened is that the hospital authorities volunteered with the government for allocating 350 bedded building separately in the campus for the coronavirus itself, as well as for the treatment. Now, our lab was in a different building. So we were able to manage initially with a separate set of technical staff who were handling only the RT-PCRs for running this. Now, our RT-PCRs were on a closed kit platform, which is the CBNAT platform, which is nothing but the gene expert kit. So the exposure from the technical point of view to the personnel was very, very minimum. But
Right.
of course, we had positives which were reported from the laboratory as well as from the physician side and the paramedical side also. So
Right.
when the first case was reported, the first thing is that we wanted to make sure that how do we triage them into symptomatic and asymptomatic. And since we had a separate building to treat these cases, so we were putting all these cases in that building. And the most important thing, as Dr. Renu was saying, was that is one first and foremost, I feel is that the motivation and also counseling to all the staff was very, very important to make them assured that this will be a crisis and they have to manage in better way. And as Dr. Sujay was saying, the HICC, which is a part of the team members for the epidemic and disaster management teams, also got together to make sure that each individual departments are having sessions with the psychologists as well as the psychiatrists for convincing and counseling them.
Oh,
And
wow.
whenever they were having positivities, they were triaged into symptomatic and asymptomatic. And if it was symptomatic with comorbidities, the hospital took the onus of treating them completely for 14 days. If they are asymptomatic, they had hired a building apartment complex near to the campus itself, and they were staged in that, and they were taking care of them very well for 14 days. And after they came back again, they were again counseled and they were reinducted into the staff where we were posted into the different departments itself. So I think the hospital authorities came up to the support of the entire staff, including the laboratory, to make sure that everyone gets a good courage as well as motivation and also to tide over this crisis.
I guess you got tremendous support, I think, with the hospital setting up a separate building
Absolutely,
for that.
Arora.
I think that was
Absolutely.
amazing
Yeah.
support. How many people? I mean, do you recall how many people actually tested positive? And did all of them come back to work eventually?
Yeah. We are a staff of about 1,500. The
Right.
positivity rate among them for about 10 months, which I took the statistics for the month till December, were about 350 people. We also
Okay.
started doing the antibody testing way back in the September for all the healthcare workers, and we found out that
Right.
nearly around 25% had already developed the antibodies, irrespective of their symptoms.
One thing that I noted in our lab, in our organization, was that most of the people who actually tested positive outside the lab. So I guess the kind of precautions that one took, during wearing the PPEs, and all the other precautions that were taken, perhaps was okay. But I guess people drop their guard when they go and have lunch together, or when they're traveling together. So we realized that a lot of cases actually turned out to be positive outside the lab. But it's great to see how your hospital supported, and 350 people turning positive and all of them coming back to work is very, very heartening for us to know. Thank you so much for that.
Yeah, thank you.
Mr. Pankaj, I guess all of us converge on you finally, that all lab heads finally put the pressure on our channel partners who supply the equipment and the kits. And Abbott, I think, played a very critical role in this over the last 10, 11 months. So just wanted to understand from you, was there any, global strategy that Abbott came up with right in the beginning, that was sort of a direction for Abbott? And was there anything specific for India that Abbott adopted, in the beginning of the pandemic?
Okay, good morning, everyone. And basically, Abbott was first to introduce the IgG serosurveillance kit in the market. And in Abbott, we believe that every movement matters. Like if a patient who is waiting for a result, and if the result outcome, he like if his life is depending upon that. So we in Abbott, we were very particular about the first of all the movement of the persons. Like the engineers were allowed to go out if there is any instrument related breakdowns. So Abbott arranged all PPE kits, sanitizers, masks, and other protective equipment for the engineers when they had to travel in the field. And they were only allowed to go and attend the critical breakdown calls. And then Abbott was also kind to get these kits transported or couriered to the engineer's residence, because it was not easy to send those kits at that time. Then
Right.
the last thing which Abbott did was like getting a road permit, because traveling at that time was really challenging. So getting the road permits and the road passes was what Abbott arranged during that time.
Right. Right.
Yeah.
And did your staff, encounter any issues? Did any of them test positive? How did you
Uh,
manage that to help your staff?
Yeah, my 50% of the engineers got positive during
Oh,
this. So it's almost half of my strength got positive. But we had a very beautiful tool which is known as predictive alerts. Like our instruments are connected through internet, Abbott link. We call it as a Abbott link, and it's a smart. Like we use technology again to get
right,
some of the errors. They can the engineers can monitor. We had a smart center technical support center team who were
right.
monitoring these errors and while they were working from home, and they were contacting the lab people and telling and guiding them to do the level 1 service on their own in case of the instrument is down, and it can be resolved at the customer end. So these were few of the things which we were taking care during this pandemic.
Wonderful, wonderful. No, thank you so much for all your support. I think none of us, no lab can work without the great support that we get from companies like Abbott. So thank you for doing that, and thanks to your team for helping us in these tough times. Dr. Srinivas, coming back to you, one of the challenges I saw that we faced right in the beginning was, getting basic kits like the PPE kit, getting the swabs, or, as Sujay spoke about, even the testing kits. So could you share your experience, since you have a large hospital? Was this a challenge for you, and how did you overcome this, like especially the PPE kits or the swabs? How did you ramp up with that?
Yeah, Aurora. Here again, I think I should really thank my government and the public health department at Tamil Nadu and Chennai, because they were our saviors for the initial 3 months. They distributed the swabs, they distributed the VTMs, and they also tried to give the PPEs from the nodal centers of the public health department itself initially. And we did had some shortages of the VTM. At that time, the local network of the laboratories which were there, which usually we have a good network with them, they also came in and pitched in for supply of the swabs and the VTMs. With respect to the PPE, since our hospital was the initial one to offer to the government 350 bedded building, we got allocation from the government itself for the PPEs, and hence we were not able to have any crisis during the shortages what other people used to find it. Regarding the kits, yes, Aurora, we had problems since we were totally working on the RT-PCRs, on the nested PCRs, which I told you initially. We
Right,
did
right.
have difficulties in the shipment as well as the shortages of the kits. So we used to triage, saying that if it is an emergency, we were doing it in-house, and if it was not an emergency, we were able to take the help of the local laboratories which were running the RT-PCRs 24 hours, and they were helping us quite a lot. And since we had a MOU with this reference laboratories, they also made sure that the laboratories get the complete support, because it was an hospital based work what we were doing. I think we did had more problem with the kits rather than that of the PPE and the VTMs. I think this is our experience.
Okay, okay. I wonder, I guess every state handled it differently. But Sujay, did you have any challenges with the PPE kits, and how did you manage those?
I think there was a steady supply of the kits reasonably. Of course, we did not go to the government. It was
Right.
only later that we realized that there was an opportunity that we could have communicated and got it from the government. But
Right.
nevertheless, I think it was meant for better use from the government side. So we kind of sourced the kits and the VTM swabs. Initially, it was a challenge. Subsequently, it started becoming available in abundance. But during that period, I agree with Dr. Srinivas. I think there were days when we were running really short, and I think some of our testing got pushed by 24 hours only for want of VTM and swabs.
Sure, sure, sure. And just to continue with you, Sujay, I think one of the biggest learnings for all large labs like yours, was coping up with how the government was looking at bringing down pricing, uh, and I guess every state government was trying to compete with each other, almost like a one-upmanship. If you can do this price, I can do it better. So, what was the learnings that you had, and how do you manage controlling cost when the government is trying to bring down pricing? And I'm sure their intentions were obviously in the right direction to help the public at large, but I guess labs must have had a huge learning experience during that on maintaining costs and trying to curb that. So maybe you could share some of your learnings for all of us.
Oh, certainly. When you look back, it looked like more of a monologue from the government. Really, isn't it? Upfront, I went for 2 meetings with the government officials on being reasonable. It started at 4,500 and being reasonable in reducing it, because at 4,000 definitely a scope for reduction as the numbers increase. But the quantum of reduction is what we were uncertain about, and we had many labs participating in the discussion. There were labs coming up with their costings of all the raw items, and then justifying why the pricing should be at a particular level. Now, at that stage, I decided to step back because it was very clear that the government was going to implement whatever pricing that they wanted in the market. So we dropped that and we started looking at our own processes. So that's where I think the optimization of the entire process, optimization of kit utilization, minimizing wastages, and the human resource utilization, optimization started to kick in, and I think we've done a reasonably good effort in all of these areas. And I think that probably helped us to minimize a small percentage of the cost.
Sure. I think, I guess companies like Abbott definitely also help that when they realize that pricing is coming down, government is reducing pricing. I guess companies like Abbott also must have played a role. So Pankaj, maybe if you could share, what was Abbott's role in trying to work with the government and the labs? I guess you were sort of squeezed in between both sides in trying to help, bring down pricing.
Yeah, first I would like to add, like the people, most of the panelists told like they were facing the challenge in getting the reagents and the supplies from the companies. So we
Right.
at our technical support center team, they played a dual role during this crisis. So they contacted each and every customer if they have any challenges on the supplies from Abbott, or they have any issues with the instrument, and
Right.
they were giving a daily feedback to the concern like commercial logistic to ensure that we get those kits and those instruments are up and running. So that was something which we did during that time. And regarding the pricing of kits, what you're saying, so we also had negotiated, in fact, try to convince the government that yes, this is something which they have to look for the better of the people, that we have to come up with a rational pricing during. So that was something which we also made. Yeah.
Thank you. Thank you for that. Thank you. Ma'am, one very important question that everybody is grappling with, and you run such a large hospital. How did,
So,
if you could just give your experience on how did you manage, going from pre-COVID days to full COVID, and then balancing COVID and non-COVID, and now coming back to probably back to pre-COVID days. This whole journey, going from down to up to down to up. How did you manage that between COVID and non-COVID?
so this whole process was a very big learning experience for us. And as we went from non-COVID to COVID, um, we had to channelize a lot of our staff to COVID. Those who were doing non-COVID work, they were channelized to COVID. They were trained and utilized in COVID areas. And even the molecular, what was being done in molecular, hematology or something else, channelized. So everyone kind of just focused on COVID. And they could do that because the non-COVID actually came down quite a bit. So whereas we were manning about 2 technicians for the non-COVID, now even 1 technician could handle the whole of it. So we got access of those personnel to move to the COVID areas. And then as it started picking up of the non-COVID, we again tried to balance. So it was a constant journey of balancing our personnel, our reagents to cater to the situation that was there. For a lot of non-COVID, which are not very essential and could be done from home, we have this thing of F8 that we do where we can actually work from home for some of the things that are very routine. We had to, at some point of time, resort to that because of the issues that were there. We did not want too much crowding in our lab. So we did that. But now we know non-COVID is there. And now we have gone back to what we had the original layout of our labs, people doing what they were doing earlier. The only thing that has happened is an additional group is being created, which also caters to COVID.
Okay. So I guess this, cross skilling has made a big difference, big help during COVID times, I guess.
Yes, yes.
Absolutely. No, great, great, great. I think people know, how the panel is going to respond. So there's a great question for you, Sujay, that, how has the pandemic made labs think about automation and reduce the human touch points? What is the future for lab automation? And we know that, nobody better than you to answer this question, especially since you've already gone in for total lab automation. So maybe you could share your experience on this. How do we look at the future in lab automation to reduce human touch points?
Thank you, Sanjay. This pandemic has made one statement, which is, I'll twist it a bit. Necessity is the mother of technology.
So true, so true.
So technology becomes applicable only if there's a strong need. And I think that need, more than ever, was felt in the last 1 year. So whether it's dispensing touch-free environment for our entire staff was the way forward. So every aspect of workflow, right from the patient entering to the result being delivered, where opportunities were simple technologies. I call this small process automation. And I think each one of us, I'm sure, would have at one point in time or the other, over a cup of coffee or anything, discussed how can we minimize touch points within this space or within this
Right.
process. And I think each lab has come out very innovatively on handling their own work. When we talk of automation, it's not the total lab automation that I'm really enamored about. It's the small processes outside of these total lab automation that actually need support, whether it's in the form of monitoring information, for example, turnaround time. Meaning total lab automation does its work, but who's going to monitor the turnaround time? That requires an automation, whether it's in the form of a software or a hardware. So all of those started to come in. And I think each one of us, I'm sure, have done our bit to bring in technology where the need exists.
Right.
It could be just a simple touch-free sensor-based dispenser to how do we handle tokens in the canteen. So there are so many aspects of our work outside of the analytical automation that needs attention. And I think the question is very relevant. How pandemic has made labs think about automation, and it certainly has made all of us think about it. And the future holds one thing, and that is the thought process. In the last 10 months, each one of us have thought of automation in one form or the other. That is what the future holds. And we will look at every process going forward with automation as one of the variables.
Perfectly answered, Sujay. I think the COVID situation has just accelerated the thought process towards technology, towards automation. And I was just listening to our honorable Prime Minister. Very nice way he said IT plus IT equals to IT. I guess that was a
Brilliant.
very, very nice takeaway for me at such. That how information technology plus Indian talent is equal to India tomorrow. And I guess COVID has just pushed us in that direction, has accelerated that thinking. And we look forward to learning from you, Sujay, on these aspects as we go along. Since we have a few more minutes left, I'll quickly go around and ask that each of us are leaders of large organizations. And maybe I'll start with each one of you to just quickly share what was your biggest learning as a leader during the last 11 months. Maybe Dr. Srinivas, you could start with that. As a leader, what was your one big takeaway or biggest learning over the last 11 months?
There are two aspects in this. One is about what did I do for my team and what did the organization, what we learned from the people around. So one thing what I learned during this pandemic is that we should make sure that the laboratories should be geared up to all the risk management and disaster management. Since in 2015 our hospital was marooned in the floods, so this was the second disaster which we were able to get along with it very easily because we had already one experience of that. The second one is that to deal with that of the multidimensional group, not only inside the campus but outside, especially with the state governments, public health department, I learned to be having patience, have perseverance, and be silent at times because everyone were in their own tantrums, including the
So true.
staff, the
So,
administration, everyone.
so true.
So
So true.
I learned these three things: have patience, have perseverance, and be silent, because this also will move across, or this also will tide over. And I would really, really like to thank my management because they were very supportive in every aspect of this, and I became to know everyone's true colors during this pandemic.
Wonderful. No, I think I guess it's been a great teaching. The kind of wisdom that we have gained through these experiences, as you said, perseverance, patience, and just be silent. Uh, Excellent, excellent. I think Thank you for
Thank
sharing
you.
that, Dr. Srinivas.
Thank you.
Ma'am, your
Yeah.
biggest learning as a
Yeah.
leader over the last 11 months.
Yeah. What I feel is that the team has to be strong. The teamwork spirit has to be instilled by the team director. that we
Right.
all have to work together to a common goal, and everyone has to be motivated to do it, because eventually that happens. The second learning was that, that is entirely my personal view, that even though eventually everyone specializes in one particular small area of a lab work, let's say, but everyone should be capable of adapting to a situation, and should be able to at least know what is happening elsewhere, and should be able to do some other multitask and do another kind of work if there is a need. And this is exactly what happened in this situation. So
Right.
these are two very important things that I found that we should do.
Absolutely. I guess as a leader, leading from the front in such situations, brings out probably the best out of the team. That when they see the
Yeah,
leader leading by example, I
yeah,
guess the team just gets completely
yeah.
motivated. And I'm sure, ma'am, with your charismatic personality, I'm sure you would have done a fantastic job. I'm sure of that.
Thank you, sir. Thank you.
Pankaj, your views on what is your biggest takeaway as a leader?
Yeah, so on a personal front, I think we should have a contingency plan. On a professional front, I would say now with the instrumentation, as what the future holds now is basically, again, it will be more and more predictive monitoring or predictive alerts, which will be in future more enabled on artificial intelligence based. So there will be more, I would say, less field engineers and more remote support. That would be the future for this in whole industry.
So I guess, as Dr. Srinivas said, I guess one big lesson for all of us is to be in a ready state of preparedness. I guess
Yes.
the more prepared we are, the more proactive we are. I guess we talk about proactive health. I guess we need to practice that proactiveness in our own practices as well, being in a sense of preparedness. Last but not the least, Sujay, your views as a leader uh, over the last 11 months.
Two things come amongst many things that have happened, which all the panelists have clearly brought out. Of the two, I think one which really strikes me is the human resilience. While when everything is going hunky-dory and very nice, the character, the attitude of human nature comes out pretty predictable. But when things are down, how do
Right.
you see the human resilience? And that's beautiful, to see the human resilience to the uncertainty, to a resilience to what can go wrong, and how do you get people to be on top of things at that point in time. The second learning for me was that we had to step back to get a better view. We cannot find a solution to a problem at the same level the problem was created. So we had to step back and get a bigger picture of all the activities that were happening. And I think we were able to see the gaps. And that was a big
Sure.
learning for me.
So to use a wider lens to get a wider perspective. Wonderful, wonderful. I guess the biggest takeaway for me, if I can get 1 minute, is I feel truly proud to be part of the diagnostics industry. I guess the diagnostic industry has truly got its due. It's got its time under the sun. We all know that diagnostics impacts 70% of medical decision making at less than 10% of overall cost. And I guess today the whole world knows what an RT-PCR test is. Entire planet knows what an RT-PCR test is. So I truly feel proud that when the world was at the receiving end, it's the diagnostics industry that got a chance, got the privilege to stand up and to make a difference, because testing is so integral to managing this pandemic. And I guess the entire diagnostic industry was given this opportunity. And I think all of us, feel proud to have been part of this whole experience, that we were able to, be part of adding value to people when everybody is at the receiving end. So for me, the biggest takeaway was that when you connect people to a common sense of purpose, when that purpose is bigger than yourself and bigger than the organization, this purpose was, across the industry. It truly brought the diagnostic industry to the forefront. And I think that for me has been probably the biggest takeaway for me, how diagnostic industry has truly been able to get its due, because of the RT-PCR testing. So thank you again. Thank you, Dr. Renu. Thank you, Dr. Srinivas. Thank you,
so
Pankaj.
much.
And thank you, Sujay.
Thank you.
Thank you, Pratibha,
Thank you.
for giving us this platform and allowing us to share our views. Back to you, Pratibha. Thank you so much.
Thanks a lot,
Thank you.
Dr. Arora, for moderating the session so well, and it was a very informed session. I hope all the people who have been watching and had got a lot of information out of this panel. For the day one, we had a very good start, and hope the rest of the day we have more deep insights coming in from the diagnostic segment. Thanks to each one of you for taking out time and coming here. Dr. Sanjay Arora, thanks a lot for moderating the session and joining us. Thank you.
Thank
And
you so
Mr.
much.
Pankaj Nath from us about
Thank you.
Diagnostics India, thanks a lot, Mr. Pankaj, for joining in. And Dr. Sujay Prasad, Medical Director, Newburgh Diagnostics. Thanks a lot, Dr. Sujay.
Thank you.
And Dr. Srinivas from Yacht International Hospital, Chennai. Thanks a lot, Dr. Srinivas, for joining in and sharing your thoughts. And Dr. Renu Saxena from Medanta, the Medicity Hospital, Gurgaon. Thanks a lot to each one of you. Please keep sharing your views and keep writing for our eHealth magazine. We'll keep bothering you for more such summits. We'll call you as speakers, and please do write to us. Thanks a lot. Thank you.
Thank you.
Thank you.
Thank you.
Thank you. Thank
Thank
you
you
all.
very
Take
much.
care. Stay safe,
Thank
everybody.
you. Bye.
Thank you.
Bye. Bye.